This week in our School Matters series, we are looking at mental and physical health issues in schools, from nurse shortages to the pressures of sports. Today, we are taking you inside Alabama's schools. A new statewide program will soon give high schools access to an opioid overdose reversal drug called naloxone. The state is the first in the nation to train administrators, coaches, and even teachers to use the life-saving drug. Now, previously, only certified nurses could administer it. Manuel Bojorquez went to Montgomery, Alabama, to show us how this new initiative works.
Jameis, Greg, call 911.
What you're watching is actually a training drill. A group of staff members here in Montgomery are acting out a scenario of an opioid overdose.
Jameis, are you okay?
The goal is to learn how to administer an overdose reversal drug called naloxone.
Jameis.
The auto-injector looks more like a cigarette box than a drug that can save a life.
Very nice job, guys.
I spent 10 years in a public school as a principal, and it's very common to be walking down the hall and come upon a situation like this.
I mean, you're learning possibly how to save a life here.
That's right.
Yes.
We needed to call 911 a little sooner.
The woman giving out instructions is State Nurse Administrator Jennifer Ventris.
So we developed this training to teach people in the absence of a nurse how to give this drug.
So a principal, a coach, possibly a teacher.
Exactly. Each high school will get one of these.
Ventris later gave us a demo with an empty injector.
So we're going to pull this off.
To inject, place black end against outer thigh. Then press firmly. 5, 4, 3, 2, 1. Injection complete.
We've not had this happen in our schools, and we're thankful for that, but should it happen, we want to be prepared.
Preparation is also underway about 3 hours north, near Huntsville, Alabama.
The drug is important because it works fast.
Where trainings had started at Sparkman High just last month.
You can lay back down.
We were there when 11th graders Bella Powell and Jackson Mays first learned how this device works.
5, 4, 3.
It's very similar to an EpiPen, so it's relatively easy to use, which is good.
More than 400 opioid-related overdose deaths were reported in the state of Alabama in 2017. According to the CDC, the state ranked highest in the nation in opioid prescriptions back in 2015. The state is said to have more prescriptions than the number of people. The drug costs $178 per dose, all paid for by a grant, meaning no cost to taxpayers.
School officials say this is not only for the safety of students. They say this can be used on anyone who comes to campus for any of a number of events, anything from basketball games to recitals.
We're one of the top states that have opioid abuse.
Eric Mackey is Alabama's state superintendent.
Schools have so many needs right now, teacher pay, supplies. Why has this become a priority?
Well, school health, our student health is a priority. And people could say, well, you ought to be investing your money just in textbooks and teachers and academic things. But there will be no good academic outcomes if there's not healthy students in the school.
He was absolutely using while he was in school.
The opioid epidemic hit close to home for Lori Roberts almost 5 years ago, when her oldest son, Will, overdosed on the back porch of their house.
It is truly one of the most painful things and hardest things that I've ever gone through.
Will became addicted to opioids during his sophomore year of high school after his wisdom tooth removal. But he was lucky. He survived.
I have been blessed so far that my son is still alive. And as a parent of a child who is in recovery, you learn that it is a every day, the rest of my life, worry.
For CBS This Morning, Manuel Bojorquez, Montgomery, Alabama.
You know, you think about that too, what you learn in school, you can use later in life too. Yes. You never know where you're going to be.
Exactly right.
And tomorrow in our School Matters series, we will talk to former NFL quarterback Jesse Palmer about the mental and physical benefits of kids' athletics. And we will be right back.